Welcome back, everyone. We are ready to start our second session. This time we'll be talking about leaves and accommodations in the age of COVID-19. And for that, I would like to welcome to the virtual stage my partners, Marilyn Clark, Jillian Kornblatt, Jolynn Markison, and Jack Sullivan, who will help us take a deeper dive into some of the FFCRA leave issues that we highlighted and previewed in the prior session, along with some additional leave issues that we may see coming in the future. So Jillian, Jack, Joe, and Marilyn, take it away.
Thanks, Ryan. And I just want to tell our audience that we are suited up just like in the picture as we broadcast from our basement offices today. So thank you. So today's presentation, and Ryan, I think you can go ahead and click to the next slide, please. So what we want to do in this session is really a lot of the information that was just laid out in the last session on the new laws and some previews of coming issues. We want to present these kind of more as they come into use. So really just jumbled all up with facts and laws and people's old problems that didn't go away that are still there, but now have to be meshed into what's happening now. So we're going to talk through these issues with hypotheticals that hopefully will draw out some of the tougher, thornier issues of these new laws in this situation. So with that, we can go to the next slide, please. So we're going to cover laws that you just heard about in detail. So the Families First Coronavirus Response Act, the sick part, and the emergency or expanded FMLA part, regular FMLA leave, which did not go away, same with Americans with Disabilities and state acts about disability coverage, and then the CARES Act, which is, of course, a giant piece of legislation, but the part most applicable to us for today is the unemployment piece. And so we'll swirl that in for you as well. And next slide. So this is our first, and I'm going to go ahead and read it even though it's on the screen, just in case anyone may be multitasking and have their screen on something else. So Eugene is not working because he doesn't have childcare due to school closure. Your company is placing some, but not all employees on furlough. Eugene asked to be placed on furlough so he can get unemployment benefits while he's home taking care of his child. What do you do? So with that, Jack, I'd like you to share your thoughts, please.
Thank you very much, Jillian. Excuse me. As an initial matter, I think that this hypothetical and the others that we're addressing here today are a good reminder that everyone on this call and all of the employees and the clients that we support are facing difficult personal situations given the pandemic. How employers respond to requests like Eugene's and all the others that are coming in will very likely shape employees' views of their employer going forward. So I think when responding to Eugene and any other employee, it's important to connect personally with him, a phone call, perhaps not an email, and to acknowledge the difficulty that he's facing. It's the sort of connection that will probably matter to an employee and that I think we all know will further our organizational values. And I think are sometimes the thing that we first set aside in the busyness of the day and the need to respond quickly by email, it's important, I think, to remember that a personal connection is an important connection. As for the legal issues, as Drew walked us through, the Families First Coronavirus Relief Act provides benefits for employees in Eugene's situation. That is, employees who can't work because they've lost childcare. That would make Eugene potentially eligible for both the paid sick leave and the emergency extended family and medical leave that's available under the FFCRA. I say potentially because, as we know, his eligibility for that leave depends on a couple factors, one of which is the size of the employer. So presuming that the employer has fewer than 500 employees, it is obligated to provide the leave that is set out in the law. As far as Eugene is concerned, which or whether he gets both of the leave that is available depends on how long he's worked for the company. So paid sick leave is something that is available to employees as of the first day of their employment. The extended family and medical leave requires employees to have been employed for at least 30 days before they would be eligible. And certainly the 30-day requirement is far less than the 12-month requirement that would make someone eligible for general FMLA leave, but it's still a threshold that should be looked at. The emergency family medical leave is the part of the leave that now has the 2/3 income replacement requirement after 2 weeks. And the paid sick leave is 100% income replacement for 2 weeks. So when an employee is eligible for both, they are eligible for 100% of their pay through paid sick leave for 2 weeks, and then 2/3 pay for the next 10 weeks. So with regard to the response to Eugene, the suggestion I would provide to a client in this situation would be to advise the client to inform Eugene of the rights that he has. So the 2/3 paid leave requirement for 2 weeks, the additional, the 100% paid sick leave for 2 weeks, and then the 2/3 pay for the following 10 weeks. And then let him proceed to take that leave, given that it is available to him. There is in the background, of course, the question of unemployment insurance and the extent that he would be eligible for that. And so to that point, I will turn it over to our colleague, Jillian Markison.
Thank you, Jack. And I did want to just note, I think the main thing when you're considering the unemployment considerations is that you want to be really careful that you're not entering into an agreement with the employee of saying, okay, yeah, you're right, unemployment is going to be better for you, so let's orchestrate this so that you get unemployment. If you do that, you're going to be running into trouble with the law. So the big decision is that if you do decide to furlough Eugene, you need to make sure that you're treating him the same as you would any other employee when you're considering whether or not to furlough. So, you're fine furloughing him, but avoid making any assurances to Eugene that he will be eligible for unemployment benefits. The real key here is that it's the state, it's not the employer who decides whether or not somebody is eligible for those benefits. And so we just want to be careful that you are not getting yourself into trouble by using that as a basis to furlough Eugene. Yeah.
Oh, thanks, Joe. Did you have more to say?
No, I was just going to say that also for the first 2 weeks of paid sick, Jack is absolutely correct. There is a portion of that statute that provides for 100% paid leave for the first 3 qualifying reasons, which relate to the employee's own health. So if the employee is out due to a governor's order or is out due to the employee's own health, then that pay is 100% covered. If the employee is out to care for a child, then it would still be 2/3 pay for the first 2 weeks under the statute.
Thanks, Joe. And touching back on what Jack said about how you interact with employees and points raised earlier, I think it's good to keep that in mind. And of course, in this situation, none of us sit here thinking that Eugene is trying to enter into unemployment fraud. But as I'm sure many of you listening today know, for parents who have children, particularly small children at home, while trying to be at home and work and handle school and childcare, it's really difficult. So, entering the conversation with Eugene with that understanding in mind will go a long way. So what if we put a twist on this situation though? Say it's not Eugene coming to us with a request to be furloughed, but what if the company is instead saying to Eugene, we are going to furlough you 25% of your regular work week. Marilyn, if you could tell us what could happen in that event, that would be great.
Sure. So one option that a lot of employers are considering instead of furloughs or reductions in force is looking at either a salary or hours reduction to defer costs during this time when they may be experiencing a business downturn. And as employers consider the options available to them, they should really think through what unemployment benefits may be available for employees to help make up any reduced hours or reduced salary that they may experience. And when looking at which option you choose, an employer should consider that if they just make an across-the-board salary cut, employees are not going to be eligible for unemployment benefits because they haven't experienced a loss in employment. They've experienced a loss in salary, but not a loss in employment. So instead of salary reductions, if employers truly have experienced a downturn in business that requires a reduced workforce, then a reduction in hours could provide employees with the opportunity for unemployment benefits in states that allow coverage for partial hours reductions. And there are also a number of states, 18, that offer shared work programs, which provide coverage for reduced hours to a much broader scope of employees. And when thinking through the benefits that are available under these partial unemployment benefit programs, as the last panel referenced, it's important to note that the Department of Labor's guidance has clarified that the federal pandemic unemployment compensation kicker of $600 a week applies to short-time compensation or shared work programs. So what that means is that if an employer goes through the state, provided that a state offers a shared work program, to apply for such a program, then employees who may not have otherwise been eligible for unemployment coverage because they're earning more than what their weekly unemployment entitlement would be, or they hold positions in the company that would otherwise render them ineligible for benefits, typically that group of employees is going to be covered under a shared work program. And what the shared work program typically entails is the submission of an application by the employer with the identification of all employees who will be participating in the program, including their social security numbers and other information about the participants. Typically, the employees, in order to be eligible, will need to experience a reduction in their hours of between 10% and 40%, and generally only regular full-time employees are eligible. So once an employer has collected and identified the individuals who will be participating in the program, it's a simple matter of applying for the program, and once accepted, all employees who are included would be eligible for a proportionate percentage of their unemployment benefit plus the $600 kicker every week. And the $600 federal kicker is not offered on a proportionate basis, it's the full amount. So as indicated in the last panel, in some cases this can mean that employees are actually eligible for an unemployment benefit that would bring them above what their regular salary rate would have been. As the last panel also indicated, some employers are feeling some reluctance about seeking benefits in those circumstances, given the broad needs of our entire population here and wanting to be mindful about not taking benefits that could go to others who might desperately need it. But it is an important and substantial benefit that employers should be aware of. If the employer is not interested in participating in the work share program, then employees can individually apply for benefits if a state provides for partial benefits due to reduced hours. But again, they may do so only on an individual basis. The employer would not be involved at all in that process. And a much smaller segment of the employee population is going to be eligible for benefits, because under most state systems where an employee is applying individually for benefits, if they are earning an amount that is above what their typical benefit amount would be in a given work week, they are not eligible. So a much broader scope of employees would be ineligible for benefits on an individualized basis. One of the tricky issues with regard to a shared work program is that in most states, if the employer lays off even one person who is participating in the program, then all applicants in the program will then be ineligible going forward. So if employers are thinking of applying for a shared work program, they should think through carefully whether all of the individuals that will be participating in the program will be needed going forward. And if there's risk that individuals may be laid off, employers should consider how to apportion participation in the program based on ongoing work needs to avoid the potential for an elimination of the entire group from the program due to a single layoff. And as Jack indicated earlier, as with all communications surrounding programs and benefits going forward through this pandemic, communication is very important. So when communicating to employees about the option of a shared work program, it's important for employers to communicate to employees that they are not guaranteeing this benefit, that there may be a circumstance that may arise in the future that would render the company and all participants ineligible, so that employees don't come to rely on the expectation that they will receive that unemployment benefit on a going forward basis. So just a range of options for employers to consider in terms of ways to meet their business needs while still helping employees stay as whole as possible on a going forward basis.
Thanks, Marilyn. And it's certainly helpful to hear about another tool employers can have in their arsenal of ways to avoid layoffs. And I will note that in terms of the CARES Act supplemental $600 a week benefit, the way the math works out, the employee would only be getting more than their normal wage if they're at the lower end of the salary spectrum. And so, there's not a fear that this is going to be going to high earners to give them a windfall. I believe the goal is to make sure that the lowest earning employees have enough to get them through this difficult time. So thank you.
That's true. And I'll add also that commentary from the Department of Labor has made clear that part of the reason for offering that $600 kicker, even on the shared work programs, is to really provide strong incentives to states that don't have such programs available to get them in place. The goal is to encourage employers to keep employees working rather than turning to furloughs and layoffs as an alternate option.
Right. Thanks, Marilyn. Okay, so now we'll move on to hypothetical number 2. So our next burning issue. So the Minnesota governor has issued a stay-at-home order, which requires non-critical sector workers to either work remotely from home or not to work at all if they cannot perform their duties from home. Luckily, your small business of about 450 employees is in the critical sector. However, some of your employees whose jobs cannot be performed remotely come to you asking to use paid sick leave under the FFCRA, citing to the governor's order as the basis for their request. Does the governor's order qualify those employees for paid sick leave under the FFCRA? Joe, we're gonna punt this difficult one to you.
Thank you, Jillian. Ryan, could you advance it to the next slide, please? Thank you. So the first thing we want to do when we're considering requests for paid sick leave under, with that first justification, which is that the employee believes they're subject to a federal, state, or local quarantine or isolation order, is we want to take a look at the order itself. And so up on the screen, I have listed out the language that's actually in Governor Walz's executive stay-at-home order. The way that order is written, it says workers in certain, and I haven't listed out all of the critical sectors, but essentially workers who are in critical sectors are exempted from the prohibition on leaving their home to go to work. And so the takeaway for this hypothetical would be that Governor Walz's order does not require workers in the critical sectors to stay home rather than go to work. So the employees in this hypothetical who are coming to you saying, because of the stay-at-home order, I want this paid sick leave under the FFCRA, you know, the answer for them is that the FFCRA would not provide that paid sick leave for them because the order does not require them to stay at home. It permits them to continue to come into work. When you're evaluating this question, so even though the answer would be no, I'm sorry, you know, and again, you're going to want to communicate this in a sensitive way to the employee. But something else to keep in mind is that even though these employees might not be entitled to paid leave under the FFCRA, you're still going to want to ask some questions of the employee to figure out, okay, well, what's really going on here? Is the employee sick themselves and so they feel like they need to stay at home, or is there some other reason? Maybe the employee has an underlying health condition and is scared of getting COVID because they think I'm, you know, in the group of people who is more likely to have an adverse outcome. So asking those additional questions to the employee, even though the employee might not qualify for FFCRA leave, is going to be important to evaluate whether some other type of leave might be appropriate, such as leave under the regular FMLA, which would be unpaid, or whether there might be some type of accommodation under the ADA that the employee might be entitled to. I also want to point out that this is an example looking at the specific language of the Minnesota stay-at-home order, but every state's stay-at-home order is slightly different. And so the answer in Minnesota would be that the employee in this scenario isn't entitled to paid leave under the FFCRA, but it could be a completely different answer in a different state depending on the language of the executive order. So you always want to be careful that you are looking at the specific language and then evaluating whether or not this subcategory 1 under the FFCRA, the employee is subject to a federal, state, or local quarantine or isolation order, whether that would apply or not.
This is going to vary a lot by state. I'm going to put a twist on our original question. So assuming we have a business here in Minnesota, let's say it's a little larger, it's diversified, it has one division that is falling under the critical sector exemption from the stay-at-home order. It's another division that is doing something different that would not fall under the critical sector order. What would you advise then, Joe?
So in this situation, if the employee is working for the company and is not working in that critical sector, what I would do is I would again look at the specific language of Governor Walz's executive stay-at-home order. The language that's used in that order is specific to workers in critical sectors. It doesn't exempt businesses who perform work in critical sectors. So as the executive order is written, and again, you know, we don't have any guidance about what Governor Walz was thinking when he made the order. So we've got to just do our best to look at the language and to try to predict how a court or how some other body is going to look at it. But I would say as it's written here, it doesn't appear to allow businesses who perform only part of their work in the critical sector to carry on business as usual outside of the critical sector, since it is specific just to workers. So the safest way to read Walz's order is to look at it and say, okay, even we've got part of our work in the critical sector. The employees who are performing that work are exempted. They are not eligible to take the FFCRA paid sick leave. But because of the language of the order, employees who aren't performing work in the critical sector arguably aren't allowed to come into work and then would qualify for the paid sick leave under that first prong of the paid sick leave statute. So they would be prohibited under the order from coming into work and would be eligible for that leave. I just want to point out really quick an example of how this varies from state to state. So if we take a look at the Colorado state stay-at-home order, the language in that order is completely different from the order in Minnesota. In the Colorado stay-at-home order, by way of example, the order exempts critical businesses as opposed to Minnesota's exemption of workers in the critical sector. And the Colorado order specifically states that critical businesses may remain open and may continue to operate as normal, and define critical business as any business that's primarily engaged in a specific list of accepted service activities. So under that order, if we have the same scenario where part of your business is in the critical sector, part of it is not, if you were in Colorado, all of those workers would be exempted and would be, would not be subject to the stay-at-home order. So different result in different states. In Minnesota, employee who's not performing work in the critical sector would be eligible for FFCRA leave, but in Colorado, the same employee, the same business would not be eligible for the paid sick leave under the FFCRA. So again, the biggest takeaway in this is that for multi-state employers, especially, but all employers, you need to look really carefully at the stay-at-home orders for the specific states where you have employees and make an individual analysis for each of the states who is and who is not going to fall underneath that first prong of the FFCRA paid sick leave for that language subject to federal, state, or local quarantine or isolation order.
Thank you, Joe. And this is such a challenging issue for employers that are in multiple locations. We've got the many different state orders. There's also local orders in place, so keep that in mind. And also keep in mind, none of this means that any of our patchwork of various state and local sick leave goes away. So you've got all of that working at once, and it's a lot to keep up with. And so with that, we're on to our third situation. Mary has been on an unpaid FMLA medical leave of absence for the last several weeks. She calls you this week to let you know she suspects she has COVID-19 and would like to switch over to paid sick leave for 2 weeks and then resume her unpaid FMLA leave. How should you respond? Joe, I'm going to call on you straight up again, so thank you.
Sorry, everybody's probably getting sick of my voice, but I promise after I answer this one, I'll be quiet for a little while. So under this scenario, we're talking about the paid sick leave statute again, and we're talking about the second and the third prong underneath that statute, which provides for paid leave because, and the keyword here is because, either the employee has been advised by a healthcare provider to self-quarantine due to COVID concerns, or the employee is experiencing symptoms of COVID and seeking a medical diagnosis. In the scenario that you just outlined with respect to Mary, she's not unable to work because of COVID-19. She's likely unable to work because of the underlying medical condition that caused her to need to take FMLA in the first place. We don't have specific DOL guidance on this particular scenario, but we do have similar DOL guidance on another scenario, which talks about workers' compensation and disability benefits, and makes clear that if an employee is out for some other underlying medical condition, then it's unlikely that the employee would be eligible to take paid sick leave if they get COVID, because the reason that they're unable to work isn't going to be because of COVID, it's going to be because of the underlying condition. And so, while we don't have 100% clarity on this exact question because the DOL hasn't provided specific guidance on it, the most likely answer is that Mary would not be able to say, hey, I'm just going to come off of my medical leave and I'm going to take this COVID specific paid leave for 2 weeks and then I'm going to go back to my medical leave. The more likely answer is that she wouldn't be eligible for the paid sick leave under the FFCRA because that's not the reason that she can't work. The reason she can't work is because she's already on a medical leave for a different medical condition.
Thank you, Joe.
I'm going to twist this one up as well. So what if instead Mary is out for a voluntary parental leave following with a new child? Jack, what would you advise in that situation?
So this is the other side of the coin that Jolynn just described. So the key determination is what is the cause of the employee's absence from work. And so if the person is out on a voluntary leave, then they have the option to return to work or not. They are not out of the workplace because of a mandatory leave. They are out of the workplace because of their choice to take the voluntary leave that's available to them. So in this case, if the person who is out on voluntary leave does find themselves in the situation where they have been diagnosed with COVID-19 and are then therefore eligible for the paid leave under the FFCRA, that becomes the cause of their inability to work, and they would be eligible for the paid leave benefits. The distinction and the analysis will really turn on what is voluntary and mandatory leave, and that'll be a case by case and state by state, perhaps even policy by policy question to answer. But the underlying and the general framework to approach these questions with is, what is the cause of the absence? Is it a choice of the employee through a voluntary leave, or is it because of their being out for some other mandatory leave reason?
That comes up in many different permutations. So for example, if somebody is on a furlough, or if they are in a situation that really hinges on whether they are able to and available to work. So thank you. So with that, we'll move on to our next situation. Thank you. So hypothetical number 4. Following the governor's shelter-in-place order, ABC Corp employee Roya's father had a stroke, and Roya will be assisting him both because of the stroke and because his healthcare provider advised him to self-quarantine due to his fragile condition. Roya is staying with her father and working from home, and she has requested intermittent leave to assist her father throughout the workday. Roya is the project manager, however, and it's important for her to be available to conduct regular virtual team meetings to keep her team on task while she's working remotely. Must ABC Corporation grant her request for intermittent leave? Marilyn, it's our time to hear from you. Thank you.
Yes, thank you. So this scenario presents, in part, a slight iteration of the issue that was just discussed in the last scenario. So a threshold question is whether Roya is eligible for FFCRA leave or whether she is eligible for just general leave under the Family and Medical Leave Act. And as discussed in the last scenario, the reason for the need for leave to care for her family member is going to be the primary guideline for which type of leave is triggered. And here, given that the employee's father had a stroke, the FMLA is likely to be the statute that governs. So the employee here is likely going to be eligible just for unpaid family and medical leave rather than needing to take a leave because her father has been given a directive by a healthcare provider to self-quarantine. It's important to note that when you have multiple potential factors that could be a trigger for leave, to provide the employee with appropriate paperwork to apply for all types of leave that might be a potential option for them, and then to work through which one of the varying circumstances, again, is the primary trigger. Now, a question would come up: what would happen if the employee here, Roya, said that she did not want to take FMLA leave and instead would prefer to only take leave under the FFCRA in order to get the paid benefit? So the implementing regulations for the FMLA specifically provide that if the employer has sufficient information to designate the leave as FMLA qualifying leave after receiving notice of the employee's need for leave, the employer may proactively designate the leave as FMLA time once they have sufficient information to make that designation. So in other words, the employer does not need specific medical certification in their hand to designate the leave as FMLA time. If enough facts, again, indicate that the employee has satisfied the requirements for leave based on a serious health condition of themselves or a family member, again, the employer can move forward and designate the leave as such. It's important to note, however, that in at least one jurisdiction, the Ninth Circuit determined that a California-based employee could affirmatively decline to use leave under the Family and Medical Leave Act. So in a jurisdiction such as California, an employee such as Roya would have the option of saying that she would prefer not to use FMLA time and instead would prefer to use the time available under the FFCRA based on the self-quarantine designation from her father's medical health care provider. So employers should really be aware of the varying laws or decisions that apply in their jurisdictions in determining what options might be available to employees. So then looking at the next question of intermittent leave, if the employee here were eligible for only the FFCRA leave, if she were in a jurisdiction where she could choose that option, and that was the option that she decided to go with, as discussed during the last panel, intermittent leave is available for purposes of caring for a family member if the employee is working remotely and is not going to be entering into a brick and mortar workplace. Here, the concern with entering a brick and mortar workplace wouldn't be as much of an issue. The concern here with Roya's father is that he has another health condition that has rendered him more vulnerable to exposure to COVID-19. So she's not caring for somebody that would expose her to the disease and that would then potentially infect a workplace. But again, if she were going to be entering a brick and mortar location, you would want to make sure you understand the reason for her request for intermittent leave so there wasn't potential exposure to others in the workplace. Here, if she were under the FFCRA, the option of working intermittently is available if both Roya and the employer agree. So there would be an option for the employer under the FFCRA to advise Roya that while working intermittently is a possibility, given her role as a project manager, it's important that she be available for meetings with her team and to otherwise run the project that she's responsible for managing. And if they can come to an agreement, then intermittent leave might be an option. Under the FMLA, if Roya qualifies for regular FMLA leave and is granted that leave, intermittent leave is available to her as a right. The employer's approval for intermittent leave is not required under the FMLA. The employer is, however, certainly able to, and it's recommended that employers do, request medical certification from the employee circumscribing what exactly the nature of the intermittent leave will be. And even in these circumstances that are very anomalous, where employees are working remotely, working from home, it's important to get that FMLA documentation on the front end so that employers can have an understanding of what the intermittent leave needs are, certainly for purposes of working with the employee during any shelter-in-place order, but also to understand what those needs might be once the shelter-in-place orders are lifted. So the employer can ask for medical certification, giving parameters about how many hours per workday the employee anticipates needing leave. And then the employer should also work with Roya to try to develop a schedule that again allows her to accomplish the business-related tasks that she needs to accomplish during the day. If, however, she is not able to cover or manage those tasks due to her need for intermittent leave, the employer will need to think about an alternate approach and how to cover for Roya while she's caring for her father. So an important takeaway in any circumstance where an employee is seeking intermittent leave is to ensure that you're gaining the appropriate paperwork if the employee is on regular FMLA leave, to understand what those leave needs are, to work with the employee to provide advance notice of what their specific needs are going to be during the leave, and then to be prepared to cover for the employee if they're unable to handle their ongoing workload, even if they're working remotely. And I've had a couple of circumstances arise with client questions during these unusual circumstances, with a sense that if the employee is already at home and is there in the physical space with the individual that they need to care for, the individual should be able to manage caring for their family member and also find time to do the work. But it's important to recall that the circumstances here are also adding increased burdens and challenges on employees. So the expectation that they're somehow just going to be able to manage the caretaking needs that fall upon them within the prescribed work schedule is something that might be unrealistic. So the same requirements that exist if the employee were coming into the workplace exist now in the working remotely world that we are now occupying. And it's important to work closely with the employee to understand what their needs are. And again, to be prepared to have others in place to cover if the employee's needs require that.
And I'm going to throw a slight twist at myself here, because what you were saying about Roya's father and his condition making him more susceptible to COVID-19 raises a quick thing that I wanted to note, which is if Roya's father were the employee, if it's somebody who has some sort of health condition that makes them more susceptible to COVID-19 and they can't enter the workplace due to that, the EEOC has put out guidance that qualifies as a disability accommodation request. So I won't take us too far down that rabbit hole, but definitely just wanted to quickly flag that. So if we can move on, Ryan, please, to our next slide. We're putting our twist here. So continuing. So 1 week after Roya requested leave, ABC Corp determined that it must furlough 20% of its workforce due to a decrease in business. Roya is selected to be included in the furlough, and she has contacted HR to say she doesn't think it's legal to cut off her paid leave benefits. What should HR tell her? Joe, I will send this one to you, please.
Thanks, Jillian. You know, this is going to be kind of a quick and easy one. So, you know, if the employer was going to furlough her anyways, then the employer can furlough her. The key here is that the employer can't use her FMLA leave or her use of FFCRA benefits as a reason to furlough her. You know, the takeaway that we really want to give to employers is that really carefully document the objective criteria that you use to select the employees. And then this again goes back to Jack's comment initially early on. When you're talking with Roya and explaining to her the reason she was selected, again, this is going to be, you know, handle with kid gloves. We're all a little bit on edge right now. Employees are a little bit on edge right now. And treating people kindly with respect can go a long way to avoiding some of these risks. You know, obviously Roya is going to feel that she was wronged, even if she hasn't been wronged. And so the way that the employer approaches her and explains to her is going to be just as important as having careful documentation of this. I did want to make one other comment, clarifying comment related to the prior hypothetical. We were talking about intermittent leave under the FMLA or under the FFCRA. And I did just want to point out, it may go without saying, but I thought it was maybe worth just a quick follow-up, that when we're talking about caring for somebody who has to quarantine, we're really talking about the intermittent leave related to the paid sick time as opposed to paid FMLA. So when we're talking about that, it would be the 2 weeks, the 2 weeks or the 80 hours of paid sick time that we would be considering providing intermittent leave for Roya to help care for her father.
some good points there that one, all of us need a little kid glove treatment these days. And also that, sometimes a question comes in like that, but instead of, talking to their HR department, I talk to my cousin who's a lawyer, or my aunt that works in HR, or I'm calling the labor department. So how you handle it certainly helps. So we are closing in on our end time, but I'm going to move quickly then to the next part of this one. I think we'll kind of skim through this one just very quickly so we can get to our last, which is a forward-looking hypothetical. So when the shelter in place ends, ABC Corp sends a notice to Roya that her furlough is ended and she should report to work in the office the following Monday. Roya responds that she is still caring for her father, and since she was able to work remotely and care for him during the shelter in place order, she would like to continue doing so going forward. Must ABC Corp grant this request? Marilyn?
So this scenario strikes at a number of requests that we anticipate will be coming from employees once shelter-in-place orders lift. As indicated in the last panel, given that employers have been able to move employees to working remotely during the shelter-in-place orders in many instances, in some instances that hasn't been possible, but in those instances where it has been, it's likely that employees may seek to continue working remotely once the orders have lifted. And in the scenario presented here, the FMLA does not require accommodations, such as granting employees the ability to work remotely. Accordingly, an employer would not need to grant an ongoing right to continue working remotely to care for a family member after a shelter-in-place order is lifted. The employer would, however, need to continue complying with any intermittent leave that was granted under the FMLA, which goes back to underscoring the import of getting paperwork in place and medical certification regarding intermittent leave needs, even when the person is working remotely and from home, so that the employer understands what those ongoing needs will be once the employee returns to the office. It is important to be aware, however, that if the employee was working from home due to their own, and was requesting to work from home due to their own physical or mental health condition, under the ADA, the employer would need to engage in an interactive process to see if a work from home option would make sense and be reasonable on an ongoing basis. And again, following the shelter-in-place orders, employers may face increasing challenges in determining that work from home is not a reasonable accommodation or would pose an undue burden on the business, given that employers have been able to manage in many circumstances a remote work option for most employees during the shelter-in-place orders.
Thanks for fitting all those points in and quickly. Good ones. And we'll move on to our next and last hypothetical. So, as with Roya, ABC Corporation sends notice to Daryl that his furlough is ended and he should report to work in the office the following Monday. Daryl responds that he will not come to work because he read a coworker's Facebook post about having been diagnosed with and having recovered from COVID-19. Daryl states that he does not want to be exposed to the coronavirus and requests to remain on leave. How should ABC Corp respond? Jack?
So this is a situation that we're seeing right now with clients that are in critical sectors and have employees who are unable to work from home. So there are instances where people have specific concerns or what they believe are specific concerns about reporting to work, whether it is simply a general fear of being around other people or whether they have some belief that someone within the workplace might be a specific source of exposure. The question of when any employee can refuse to perform a task is a question that's answered by OSHA. And this is an example of where an existing law and an existing framework of analysis applies to our current coronavirus situation in a way that probably was never anticipated when this OSHA rule was created. So the OSHA rule clearly would have applied to, I'm going to refuse to climb up on that rickety scaffolding, or I'm going to refuse to work with that rusty chainsaw. Here we now have people who see a risk of some other sort of workplace danger and are expressing concern about performing a task because of that perception. So the OSHA rule requires that for an employee to refuse to perform a task, they have to meet several conditions. And the first is they have to have asked the employer to eliminate the danger that they perceive, and the employer has to then have failed to eliminate the danger. That request and the employee's refusal has to be in good faith. They have to subjectively have a belief that there is an imminent danger to them. And then there's also an objective component to that belief. So a reasonable person in their shoes would have to also agree that there's a real danger of death or serious injury if the task is performed. And then finally, in terms of the refusal to work, to simply say, I'm not coming in because of my concern, there has to be an urgency to the hazard so that the employee can't seek safety by going through the typical process that would be available to any employee, which would be reporting the concern to OSHA and having an inspection come out and determine whether there's a safety issue there or not. So I think the goal here would be to listen to the employee and understand what their concerns are, and then look at the elements of this test that relate to eliminating the danger and a reasonable belief in the presence of an actual danger of serious injury, and then apply those to what we all are learning about social distancing and the several requirements that are being announced generally to the public about ways to keep ourselves safe, and to ensure that those same guidelines are being put in place within the workplace. So going back to our critical sector clients that we've been working with, you'll have a lot of solutions that are things as simple as marking tape on the floor of the manufacturing facility to make it clear what is 6 feet away from a workstation, what are 6 foot gaps around a time clock. So when people are queuing to enter the workplace, they know how far to stay away from each other. Staggering breaks, and so that there isn't a group of employees who are all off on break at the same time. So these are the sorts of strategies that will go toward the objective belief that there's an actual risk of serious injury for an employee when they're at the workplace. And finally, so when we're comfortable that all those elements are in place, and you have an employee who is still refusing to work, employers' current policies about attendance, no call, no show, whatever it might be, can be applied. So while we're listening to the concerns that the employee has, at the back, we are able to determine, if we've walked through this analysis and it's clear that the person is not refusing to work in good faith, that it is not an objective belief that a reasonable person would agree that there's a risk of serious injury, given the protections that are in place in the workplace, then this would be an employee who potentially would be able to have discipline applied because of the refusal to come to work.
Yeah. And to tie it all together back to our first session, these OSHA kind of complaints certainly could be a wave to come of retaliation claims. And what we advise employers to do in terms of what's reasonable in terms of safety is consult the CDC guidance. It's online. It will be updated. There's guidance for employers generally. There's guidance on cleaning and what is a reasonable way to clean the office. So with that, thank you for attending this session, and we'll let you have a little break. Thank you.
Jack, Joe, and Marilyn, and you've made it abundantly clear that we have more to look forward to and that the devil will be in the details. As Jillian says, we're now going to take another short break. We will be back at precisely 10:40 a.m. Central Time for our next session focusing on business integration in the post-pandemic world. We'll see you all in a bit.